Hello, good afternoon, and welcome to Real Talk with Mrs. Pham on Kosoro Evergreen Radio. Happy Sunday to you. On this program, we confront real issues affecting our communities. Today, we are asking, can we confront diabetes before it confronts us? Today on the show, I am joined by someone who is living with type 2 diabetes and is insulin dependent. This is a lived experience. So, yes, we're talking about diabetes. What is diabetes? Diabetes is a long term condition where the level of sugar in the blood becomes too high. I'll explain it a bit further. Insulin is a hormone that helps move sugar from the blood cells from the blood into the cells. In type 2 diabetes, the body either doesn't use insulin properly, that means insulin resistance, or it doesn't produce enough insulin. Over the time, some people need insulin injections to control their blood sugar. Let me clarify this gently. Needing insulin is not a failure, it is a treatment. I'll briefly mention some of the complications if this is unmanaged. It can cause heart disease, kidney damage, vision problems, and nerve damage. Now, we're going to introduce our guest on today's program. His name is Mr. Taiwo Fambegbe. Mr. Taiwo Fambegbe, it's nice to have you on the program.
Thank you very much for having me. It's my pleasure being here today to share my experience on diabetes, effects of diabetes, and the control of diabetes.
Thank you so much. Mr. Taiwo, how were you diagnosed? Do you mind sharing that with us, please?
I remember vividly, sometimes 2008, I started, rushing to the toilet every like 5-10 minutes, feeling thirsty, having appetite for drinking cold milk, water. And my wife now asked me to go and see the GP to check. And I went to the GP, and the GP asked me to do urine test, and took some blood and checked on it and found out that my blood was really. The GP couldn't even believe that I can walk by myself to the surgery. So since then, I was diagnosed with a high blood sugar.
So those were the, because I was about to come into what were the symptoms, what were the signs. You mentioned that you wanted to drink more and more.
Feeling thirsty,
water, milk, anything.
In the middle of the night, you go to the fridge and be drinking cold milk, and then using the toilet incessantly.
Yeah, I think for some people, it could be unexplained weight loss.
At least before it gets to that stage, it starts from
somewhere. From wanting to drink more,
if you don't,
or sweating even.
Yeah, if you sweat when you have a low blood sugar, hypo. When your blood sugar drops, that's when you feel sweaty and feel hungry as if you've not eaten for the whole day. You feel shaky.
Mr. Taiwo, I'm going to ask this question. Please, if you do not feel comfortable answering this, please, by no means should you answer it. How did you feel emotionally when you first was, told you have diabetes, and then this is like a lifelong disease? And how did you feel emotionally when that news was broken to you?
Unfortunately, around that time, I didn't even have much experience about diabetes.
Okay.
I didn't even really know what diabetes is. It was when I was told, and the look in the face of the GP, and then I began to research and found out that
So prior to that, you had no
I had no
idea. Like
idea
you
what
didn't have a family
I
member
was.
who had diabetes
My,
or
my dad had diabetes. I heard, but I didn't really
know
know
much
much
about
about
it.
it. You know, I knew my father was taking medication for diabetes, but it's not something that I really, know much about until it happened to me. And a series of questions were asked. How many people in your family has had this and that? And
You mean your doctor asked you
yeah,
those
yeah,
questions?
yes. And I told him about it, and I said this. Sometimes diabetes is something you cannot avoid. It might be hereditary. It might be carelessness in
You
taking
mean like lifestyle?
lifestyle. Your lifestyle could cause it. But mostly, according to research, most of us black African is very common among us. This diabetes.
You mean like in our community?
Not like our our race,
Yes.
not community.
Mm.
It's our race. It's in our gene.
It's in our gene.
You know,
Africans.
Africans.
So that will make me ask you again, because you said you're insulin dependent. What is your reaction to having to inject yourself every day to live?
From my experience, you don't just jump into being insulin. First, you'll be asked to watch your diet, work on your diet, then tablets like metformin will be introduced. If it doesn't control it, then it goes on to insulin.
So you mean first they will advise
Yes.
of lifestyle
Lifestyle
changes
change
before they even put you on
on
any
any
medication?
medication. Yeah.
Okay. So if that
So
doesn't work,
if it doesn't work, then
then they introduce you to medication, and if medication is not
no,
enough,
not medication, tablets.
tablets, yeah.
Yeah.
And if that doesn't work,
If it doesn't work, then you'll be insulin. But unfortunately, in my own case, my pancreas wasn't functioning. It
I
was
see.
after so many tests and checks, and it was found out that my pancreas that is supposed to be producing insulin to work on my blood, to dissolve all the sugars in my,
it wasn't working
it
properly.
wasn't working properly. So insulin is a form of artificial way of inserting insulin, which your pancreas cannot produce,
I see.
into your system to work on the food or on your body.
Very well. And what are the lifestyle changes? What lifestyle changes did you make?
It's so hard. I will advise anybody with diabetes to just accept it, deal with it, because it will change your life.
In what way, please?
Most of the things you like to eat, you have to not stop it totally.
I get you.
You have to control the way you eat it or eat them. You have to adapt to your medication, and
Religiously.
you have to adapt to your medication. And sometimes all these medications, they have adverse effect,
Okay.
like erectile dysfunction. It could cause it. It could, you know, a lot of things can happen during, if you're not mindful. That's why you have to be careful with what you eat and how to control your diabetes.
And going for your checks, I believe, as well, regularly.
That is
Like
one thing.
the eye checks.
One thing I don't joke with. It's so depressing if you find yourself in this situation. I'll be sharing or advising anybody with diabetes. It is not a killer like the way people get scared about it that, oh, the moment you have diabetes, it's like you've got cancer. No, you have to live your life, enjoy your life to the fullest, but do the normal thing
In moderation.
in moderation. Go for your check, do your checks, your feet, your eyesight. Don't miss your checkup. You have to work with your nurse,
Look after your
diabetes
skin.
nurse. You have to work with your GP because they're there to look after you. But sometimes it will look as if this is too much for me. But when you do it religiously and you cooperate with them, you find out that you will live a better life.
Mr. Taiwo, were you afraid when you were told that you had diabetes?
As I said, I was like confused, but because I don't really know have much, education on it, or really know much about what diabetes is. It was after being diagnosed that I started making research
On it.
on it and being advised by my doctor. And fortunately for me, I have a very good
Support network.
support network from family
That's good.
and from my doctor, which made me to understand a lot about this diabetes, and I kept on with it. And today I'm a very happy man.
Did you face any stigma at all?
No, because I told my mind I accepted it. These are the mistakes which I would like to advise our listeners. Because when you have this, you have it for life. People might tell you, if you go on internet, you will see different motivational speakers about diabetes, people that are not even professionals, people that have no idea about it, even people with African mentality
about spiritual attacks.
spiritual attack, all this kind of stuff. It's not a death sentence.
And this is why this kind of platform is very helpful, because here we will talk about how people need to change their daily, routine, lifestyle changes, maybe exercising, changing their diet, and getting support, like you said, from family,
And you
professionals.
need to support yourself at the same time, accept it, and move on with life. It's not, as I said, it's not a death sentence. It's just control.
Control.
And with this will help you to have total control of your health. A lot of things that you don't even know about by visiting your GP, doing a periodic check.
You've heard the story. Now let's hear from you. We're asking callers to call in now. Do you live with diabetes? Are you caring for someone? What myth have you regarding diabetes? Are we doing enough as a community? So, Mr. Taiwo, regarding prevention, it's recommended that people reduce sugary drinks, eat rich fiber foods, exercise at least 30 minutes a day, do annual screening. You mentioned, about going for regular, checks.
Which is very, very, very important. And always listen to the advice from your diabetes nurse, your GP, and your medication is very important. The way you take your medication, because sometimes it's not just about. There's some the insulin is something that you have to take before meal immediately after meal, because this is going to work on the food that you've just eaten. So it's not a joke.
And early detection, Mr. Taiwo, is it especially for people over 40 years, or maybe they have the history in their family, or some people that are believed to be overweight? Are these some of the factors that people should take into consideration, when trying to detect this disease?
You have to. I will advise everybody, the moment you're getting to 40, make sure any little thing that happens to you, see your GP, do a check, do a blood check, urine test. All these things will detect a lot of things. From some people, when they ask them to come for maybe a check, they won't go. They think I'm okay. I've had people that will tell you, "Oh, I don't fall sick. I'm not a sick person." So let me just try to finish up my sentence there. I want to let my our viewers understand that,
And our listeners.
listeners,
Yeah.
understand that diabetes is not something that will, kill you immediately. It could be in your system for 10 years and keep damaging all the systems,
Or the organs.
all the organs, your kidney, your liver, it could cause neuropathic pain, which is very painful. I've experienced neuropathic pain before.
Can you talk us through that, please?
Yeah. What I'm trying to say here is that diabetes will not kill you immediately, but instead of you to die in 10 years, it will extend your life, prolong it to another 30 years if you control it.
Well controlled, well managed.
If it's well managed. So that's the advantages of taking good care of yourself, But this neuropathic pain is a form of tingling in it's either I had it in my arm, right? Left arm, I remember, left arm.
Right.
And it lasted for about 6 months. Very painful. And sometimes your fingers will be numb, as if they are not functioning. But with the support of my GP and a lot of different medications that were tried before, I got healed of it. And since then I've been fine.
That's good.
That's
good. So, like in the UK, you mentioned that contact your GP for blood sugar testing.
Yes.
Diabetic risk assessments.
Yes.
Where you have to, engage with your nurses, maybe for different checks, eye checks,
Yes.
other checks that may be required, testing your blood sugar, your blood pressure, cholesterol. So these are the supports that are available in the UK.
Yeah, it's available everywhere, but the system in United Kingdom is very, very good because to me is the best so far that I've seen.
Very well. And then, sorry, Mr. Taiwo, we have a caller on the line. Oh, we have a text message. I am going to read the text message now. And this is from Josephine. And good afternoon, Josephine. Thanks for coming on the program. And she says, our question is, how do we know the earlier signs of diabetes and what should we do? She says, how do we know the earlier signs of diabetes and what should we do? Mr. Taiwo, do you want to answer that, please?
Yes, the earlier signs of diabetes are like you being thirsty for water every time, and you have to watch the way you urinate. If it comes often,
like going to the toilet.
Toilet every time, then you need to watch out and do a diabetes check. Complain to your GP or to your doctor about it to know this. It's not just happening. There's
something is going on.
It's going wrong.
Don't ignore
the signs.
And I would like to quote as well. Over 4 million people are living with diabetes in the UK. Type 2 diabetes accounts for around 90% of all diabetes cases. People of African and Caribbean heritage have a higher risk of developing type 2 diabetes compared to the general population.
That's exactly what I said.
This is not a distance issue. It is in our homes, it is in our communities. I have another text message there. She said, oh, okay. I wanted to ask, for people with diabetes and living in Nigeria areas or communities where they can't access therapists, what could be the best go-to solution considering the impact of diabetes on their mental health?
It's so unfortunate.
It is.
It's so unfortunate that you find yourself. I've even seen a friend who lives in America who doesn't have insurance. You know, in America, if you don't have medical insurance, you might not have access to medical
Help, support.
or support. Whereas in United Kingdom, it's a different case. So the same problem that we're talking about, but in the issue of Nigeria, there are so many herbal help
Yes.
in Nigeria,
Yeah.
like something called abiri.
Okay.
I forgot the botanical name, but anybody that is listening now should go and read about abiri.
Okay.
Abere, abiri.
Okay.
Abiri seed is very, very good. You just need to soak it in water. But if you take it on Google and read about it on Google, it's very helpful. I took this many years and I'm still taking it.
Right.
In support,
In addition to
my medication. But if anybody tells you that, oh, come and see my pastor or this or that, you are just...
They need medical help.
You are just writing a letter to death.
Early detection.
And
advice from professionals.
Advice from professionals, and make sure you take medications.
Yes. And go for your checks
and
regularly.
Go for your check, and make sure you watch your diet.
Right. Okay. I'm going to read some of the other messages. Hello, good day. My name is Helen, joining from Lagos, Nigeria. Mrs. Pham, that's me. I just want to appreciate you for the insightful and educative topic you always bring to the show. They are truly impactful and informative. She says, I have a few questions regarding diabetes. I know a young woman in her late 20s who is not overweight but has been constantly tired, drinking a lot of water, like you said, urinating frequently, like Mr. Taiwo said, and losing weight without trying. She thinks it's just stress from work. Could this still be diabetes even though she's not overweight? How can someone tell the difference between stress symptoms and early warning signs of diabetes? I must say before I go on to Mr. Taiwo is not a medical doctor. It is just sharing lived experience, being a diabetic patient. So he's only talking not as a professional, but somebody who is living with diabetes. So Mr. Taiwo.
My best advice to your question is there's no point guessing. Go to your doctor. Go and check. Simple.
I'll go to the next one. Someone in his early 50s was told during a routine checkup that he is pre-diabetic. That's someone on the borderline. Am I correct?
On the borderline.
He feels completely fine and believes it's not serious since he hasn't been placed on insulin or medication. So he hasn't made any lifestyle changes. How serious is pre-diabetes really? If someone feels fine, is still dangerous? Is it still dangerous? And can it truly be reversed with lifestyle changes alone?
Definitely. If you have been, that is before one is before harm. You've been told that you are on the borderline.
Borderline, yes.
All you need to do is, if you are somebody that drinks alcohol, so I'm not saying stop totally.
In moderation.
In moderation. Drink socially. Don't make it everyday thing. And your sugar intake, beverages, I'm sorry to say, anytime I go to Nigeria, I watch myself because before I drink anything, I always look at the label to see the content of what I want to drink, to see the sugar content of it. And I found out that most of the drinks in Nigeria has no content. So you don't even know what you're drinking, especially when you drink Coke or you drink some beverages that you see in shops. I avoid them totally. And the good thing about Nigeria is that we have all these fruits naturally there.
Yes.
So you can make, like myself now, I make my own juice. I make my own smoothie at home.
And veg?
I'm veg.
You eat a lot of fresh food?
I eat a lot of fresh food, veg,
meat,
fish, and I avoided. I avoid sugar. I avoid all these drinks from shops.
So that answers the question of if you're on the borderline, it is best to keep a healthy lifestyle. And maintain that healthy lifestyle.
Don't say, I'm fine. You might be fine, but you are getting closer. You're always almost crossing the border into diabetes.
So I'll go to the next one. A family friend has diabetes and says her blood sugar readings are usually normal. I believe you will know about this now. So a family friend has diabetes and says her blood sugar readings are usually normal, yet she's experiencing numbness in her legs and occasional blood vision. If someone's sugar levels appear controlled, why would complications still occur? What could they be missing in their management? They're still having blood vision. I remember you said to go for your eye check regularly.
Because I didn't even know that I had cataracts. One of my routine checks was when I was told that if this is not taken care of, it might affect me in the future, nearest future. And
could it cause blindness?
Yes, definitely. I didn't, you won't even know. It's the professionals, when they do your check, they will know. And I was, at a certain stage, they told me my left eye is really bad. That it was really bad. And they advised me to come for the surgery.
So you had a surgery?
Yeah, I had a cataract surgery on my left eye.
And how is it now?
And because of diabetes, I had infection on it, which is because of diabetes, because it's very hard when you have it. And it was well managed.
Infection, you mean it didn't heal on time?
It didn't heal on time.
And so, talking about things not healing on time, so we have the belief that people with diabetes, when they get infected or they get injured, it doesn't heal.
That is it.
On time.
I've had that experience.
You have?
Yes. And that's why I watch out for everything, even my feet, my hands. I try to avoid anything that
Mr. Taiwo, you mentioned feet now.
Yeah.
Do you advise, I know you're not a professional now, but you're somebody who has this much experience with diabetes for many years. Do you advise people, this is very, very important now, that people with diabetes should not be walking barefooted?
You shouldn't be walking barefooted.
Why do you say so,
You have to wear something. Even the shoes you wear, you have to watch out for the shoes you wear.
What kind of shoes should I wear?
You have to wear a shoe that is comfortable, that is not really hard on your feet. That is, any shoe you wear that you feel in pain.
Don't wear it.
Don't wear it.
Don't wear it.
Yeah.
And they should not walk barefooted.
Even in the house.
Even in the house.
Yeah. You have to watch your palm. I mean, your feet, your palm, everything.
And how do they look after their nails? Should they cut it themselves, or should they go to like a chiropodist, or
so we are very like myself, I'm not really good in doing things like that for myself. So I go to the show, but professional. I don't mind how much it costs me to take care of my health. You know.
I'll go to our last text message there. He said, "There's a 10-year-old child who consumes a lot of sugary snacks and is gaining weight rapidly. His parents believe children cannot develop diabetes. Can children really develop type 2 diabetes?
We have.
What warning signs should parents watch out for?" And they say, "Thank you so much for addressing these questions."
I know of a child that for a long time, from age like 5 years old, that's been, diagnosed with diabetes.
I know a lot of
and has been on insulin.
Mm.
So it doesn't mean a child, even apart from being for diabetes, it is not good for kids to be taking too much of those drinks or chocolate, or you need to watch out anything you do in excess. I remember my son sometimes, when he was still a child, and I found out that he doesn't even drink water. He drinks, soda and all those kind of drinks, beverages, and that's what he drinks. But what I did when I couldn't stop him is I stopped buying it in the house.
You stopped buying those
Yes.
drinks?
I stopped it. So, and that's how he started drinking water. So the parents has to be in control, and we shouldn't take it for granted, because the after effect of it is not a good thing.
And what about the mental impact it has on people? I'll give you an example. Somebody now has diabetes. They are on medication, or maybe they have to inject themselves, with the insulin injection, with insulin. And unfortunately, some people, lose their sight. Some people, maybe already have high blood pressure. Some people have their limbs, cut off, which is a very sad thing. So I'm asking, how do people cope, mentally, having to rely on other people to care for them? How do people cope, with this disease?
It's unfortunate. We shouldn't let it get to that stage. That is my own advice. And that is what I'm really, really, really emphasizing on people. Don't let it get out of hand.
We should not neglect it.
A stitch in time saves 9.
It does.
So when it gets to that stage, it's a different ball game, that you've already having blindness or kidney failure or stroke. There's no two ways. It's something that is very, very sad.
Unexplained weight loss. So anybody that feels, okay, I have diabetes, take care of it. Take your medications. Watch what you eat. If you can't go into gym for exercise, walk. Even in the house
you can walk. Like most of the time when I'm not driving, I walk. Even walking is more, especially when you are at the age of 50, 60, you don't need to be hitting the gym. You want to kill yourself?
I don't think I want to agree with you with that.
No. What I'm saying is, if you want to hit the gym, you are not a young person. You can go and do just normal exercise.
Okay, now why I said I didn't agree is because I don't think we any age should be limited, or say, at this age you shouldn't.
There's some things at a certain age you don't do in the gym. You have to be careful what you do, or else you will still injure yourself.
Yes, okay.
So
I agree that you can only do some certain things if you're able to do it.
Yeah.
But you can always go there. Yeah.
You can go to the gym, but it's not everybody that can go to the gym. My advice is, do a lot of walking,
Yes.
and engage in a lot of, community service. Even in your garden, mowing your lawn is a form of exercise.
It is. Even cleaning the house.
Cleaning the house,
rather than
using the Hoover,
getting everyone to do it for you while you're sat there watching the TV.
Even dancing.
Yes, that's a good form of exercise.
It's a good therapy.
It is. I agree with you.
It makes you happy. Go to parties.
Yes. This is from Olatunji Oluwadare, and we read out the questions he asked, and this is his advice now. He says, don't isolate yourself. Talk to trusted family members, friends, or connect with support groups of others battling the same condition. Sharing your experience can significantly reduce feelings of isolation. Thank you so much, Mr. Tunji. I'll go on to our next message from Kemi. She says, good afternoon, Mrs. Pham. I have been trying to call in. I am so sorry about that. We've had technical issues this afternoon. We hope to correct that by next Sunday when we come on the program. I remember growing up in Nigeria. Diabetes is not talked about, and we know less about this disease. Now, coming to the UK, I see how many patients have been looked after. I did care for years. I want to believe he meant he worked in the care sector for years, and she said she cared for few diabetic patients with care around the clock. To come back to who was diabetic and died because of nonchalant attitude to the illness. We need to learn more about this illness and other. Thank you for what you do, Kem. Thank you so much for sharing this sensitive issue about your uncle passing away from diabetes. I am so sorry to hear that. And you mentioned as well that this wasn't really talked about in Nigeria. I believe it is talked about, but we just need more awareness around it, and as well not being shameful about it. And I know you mentioned nonchalant attitude. Mr. Taiwo mentioned the same thing earlier on, Mr. Taiwo. Do we want to talk about this nonchalant attitude? People thinking or saying, I don't like taking medications. Nobody can tell me what to do. I know how to look after my health.
It's easy to give up in life or give up on life. That's why I'm advising people that the care you give, some people,
3, 4, 5.
Some people can use their money to buy expensive clothing. They can go to restaurants, and especially in Nigeria, they drink alcohol as if they want to commit suicide. And these are the things that is killing. Apart from diabetes, excess of it affects your liver, lungs, kidney. So most of these problems are lifestyle problems. So we need to watch out and be disciplined. If you are not disciplined, you cannot, I want to use myself as an example. In my car, if I'm traveling anywhere, the first thing I will pick is my medication before my clothing. And I have a set of medication in the house. I have a set of medication in my car. Because sometimes, from experience, I might be driving on the way and I just realize my blood sugar has gone up. Maybe by eating, or maybe stopping on the way to eat or having lunch while I'm outside, and my blood sugar springs up. The moment I say that, I go into the toilet. I'm not shameful about it.
I like the word that you're not shameful
I'm not shameful.
about.
It's my health. I go into the toilet. I put in my insulin. I use it. I come back, and after maybe an hour, my blood sugar will start coming down. And there's sometimes you have to be watchful. Sometimes it drops to the level of hypo that is too low. But I will advise something that the new magic now that is out there is called Fibra. Fibra is a form of blood sugar monitor. It's called Freestyle Fibra Link.
Okay.
That it will be attached to your arm.
Under your arm.
Under your arm, and you have the app on your phone.
Okay.
This is a 24 hours monitoring. And this has been a game changer for me.
Very well.
So anybody that's diabetic, try to ask about it from your GP. If you are living in United Kingdom, tell your GP to give you Freestyle Libra Link blood monitor.
Thank you so much. So today we're confronted with one of the fastest growing health challenges affecting our communities, type 2 diabetes. With a powerful lived experience from a guest, Mr. Taiwo, who is insulin dependent, we have been able to explore what diabetes really is, the emotional impact of the diagnosis, the cultural myth, prevention and lifestyle changes, how to access help in the UK. Diabetes is indeed serious, but it is manageable. Early testing can save life. If you've missed today's show, catch the replay on Kosoro Evergreen Radio, Real Talk with Mrs. Pham, Diabetes Awareness, Health Matters, Kosoro Evergreen, Community Health. Mr. Taiwo, thank you so much for coming on today's program.
You're very welcome.
Thank you so much. We really, really appreciate it. Today is, we discussed one of the most sensitive topics, but it's something that we really, really, really need to discuss. And I'm happy with the engagement that we have. I apologize for the technical difficulties for people trying to reach us, calling in, but they couldn't. But please, next Sunday, try again. Hopefully, we would have sorted the technical issues. But, you can either text, drop voice notes, we will get all your messages as we have done today, and we'll read it. Thank you for all the listeners. Thank you for people who have engaged, by calling or by texting or by dropping voice notes. So we meet again on Real Talk with Mrs. Pham on Kosoro Evergreen. I remain your host, Olayinka Phambegbe. Bye for now.